ring, or else if the patient is wearing any bracelets, we have to remove all such things, and we have to insist the patient to come in a proper manner by not wearing the metal objects. Okay. So once after the patient gets inside the X-ray room, so we have to ask the patient to sit in a table near to the X-ray detector. Okay. So the patient will sit near the X-ray detector, and the patient's hand should be placed on the detector, and after placing the patient's hand, we have to position the X-ray tube. Okay. So I'll show you a demo of X-ray PA hand X-rays are taken. Okay. So the patient will be sitting in a stool, and the patient's hand will be placed in the image receptor. Consider this as the image receptor, and the patient's hand will be placed in the image receptor in this position. Okay, this is known as dorsipalmar projection. Okay, so consider the X-ray tube is straight to the patient's hand. Okay, so when we are switching on the X-ray tube, and a laser light will get projected, and the laser light will pass through the patient's center of the hand at the third metacarpal. So at the third metacarpal, the X-ray projection will be there. The mid center of the projection will be at the third metacarpal. So we have to position the patient's hand in the dorsipalmar projection, and we have to elevate their fingers. For what purpose we are elevating the fingers is nothing but the fingers will not get overlapped. So we have to elevate the patient's finger, and we should insist the patient not to move their hand until we get exposed. Okay. So the patient's hand will get still in this projection, and we have to keep the exposure factor such as kV 50 to 60 kV and MAS 2 to 4, or else within 5 MAS we will be keeping. The exposure factor will be like this, and we will not use any grid for this projection. Okay. So by this projection, hand PA will be taken, and for the oblique projection. For oblique projection, we have to position the patient's hand in such a way like this. Okay. So this thumb finger and index finger should not get joined or should not get overlapped. So this projection will be exact for the oblique projection. Okay. So the patient's hand will be like this, and we have to elevate their fingers, and by this projection, same third metacarpal is the centering point, and by keeping the third metacarpal as a centering point, we get exposed to the patient. Okay. This is known as hand oblique projection, and for hand lateral projection, the patient will be sitting same in the X-ray tube, same in the table, and the patient's hand will be projected in the same projection, and their thumb will be like this. Okay, all the 4 fingers will be facing straight, and their thumb projection alone will be placed like this. So this is the hand oblique projection. Okay, so for hand oblique projection, the patient's hand will be like this, and at the same this metacarpal, the first metacarpal will be the centering point, and by keeping centering point as the first metacarpal, will get exposed. Same exposure factors will be followed for the oblique projection and for the lateral projection also. So until and unless we get unless the exposure is done, the patient's hand should not get moved. Okay, if any movement, or if the patient, for example, if the patient gets moved or if the hand gets moved, we get an artifact. So for that purpose, we are supposed to insist the patient not to move their hand, move his or her hand until we get exposed, until the patient's hand gets exposed. Okay. On the next projection, we are going to see about this both hands. For previously we had only one hand, and now we are going to see about both hands. Both hands PA, that is also known as dorsipalmar projection. Okay. So for both hands PA, imagine this as image receptor. The patient's hand will be placed in the image receptor, center to the image receptor, and the patient will be sitting on the table. Okay. So same as like for PA hand projection, we kept the centering point as third metacarpal. For this projection also, the X-ray, the centering line will pass through the third metacarpal. So third metacarpal is nothing but this is the third metacarpal. So here we will be keeping the centering projection, and KVMAS will not get different. The same KVMAS will follow through this projection also. Okay. So after keeping the hands, we will get exposed, and the images will be shown like this for both hands. Okay. And the next thing is one special projection. All these things are basic projections of hand. So one special projections of hand is there. So that is known as ball catcher view. Okay. So for both hands, if there is any if the patient is having any fracture in their hands or else in their fingers, this projection will be more helpful for the radiologist or else for the orthopedic surgeon to easily analyze the fracture. Okay, so for this projection, both hand ball catcher view projection will be taken. So ball catcher view is nothing but when a ball is coming when a ball is coming through your way, how you catch the ball. So this is the way you catch the ball, right? So this is the same projection for ball catcher view also. The patient will be sitting on the table and on the chair, and imagine this is the image receptor, and ask the patient to keep their hand in such a way by expanding their fingers. By expanding their fingers, so in the ரெண்டு fingers என்ன ஆடுறோம்னா either ஒரு at least ஒரு 2 inch of the gap இருந்தா என்ன பண்ணுவாங்கன்னா ball வந்துட்டு catch பண்ற viewல we have to project the patient, and then we will be taking the exercise. For this also same third metacarpal bone only, the centering point, the central ray will pass through the third metacarpal bone. Okay, so same like this. So we have to insist the patient to be still in this position, not to shake their fingers. So by taking this projection, we get the exercise like this. Okay, so for doing this projection, we have to ensure that the marker is there or not. Okay, the right marker or left marker must be there. Either right side, for example, and the marker side kaga nama edutrom appadina idu right hand idu left hand appdi solittu identify pandradhukaga we have to keep the markers. Ennala appadina sometimes the images will get overlap, twist ஆயிடும், flip ஆயிடும். Okay, so flip ஆகும்போது doctors will get confused. அதாவது radiographies ஆன நமக்கு தெரியும், so நான் இது வந்துட்டு ரைட் ஹேண்ட் இது வந்து லெஃப்ட் ஹேண்ட் we can analyze, பட் ஃபிலிப்ல வரும்போது அது flip ஆகி வந்துச்சுன்னா டாக்டர்ஸ்க்கு என்ன ஆயிடும், ரேடியோலஜிஸ்ட்க்கோ இல்லை வந்துட்டு ஒரு ஆர்த்தோபெடிக் டாக்டருக்கோ என்ன ஆயிடும் அப்படின்னா, ஸோ அவங்களுக்கு ஆட்டோமேட்டிக்காக அது கன்ஃபியூஸ் ஆகிடும். ஸோ அப்போ வந்துட்டு எந்த ஹேண்ட் அவங்களுக்கு ஃப்ராக்சர்னு தெரியாது. ஸோ அதனால we must ensure that before exposing the patient marker இருக்கா இல்லையா அப்படிங்கிறத ensure பண்ணிட்டு தான் நம்ம என்ன பண்ணுவோம்னா எக்ஸசைஸ் எடுக்கணும். ஸோ சேம் அதே மாதிரி தான் இதில் வந்துட்டு எல் மார்க்கர் வச்சுருக்காங்க பார்த்தீங்கன்னா, ஆர் மார்க்கர் வச்சுருக்காங்க பார்த்தீங்கன்னா. ஸோ மேலே